A Jones fracture occurs on the proximal end of the fifth metatarsal after a forced inversion of the foot in plantar flexion. This can happen while stepping off steps, dancing, or running.
Hi, Paige.
Hello, Rachel.
What are you in here for today?
So yesterday I was walking home and I fell down a step and my foot kind of twisted inwards and I felt pain along the outside of my foot. And then I went home and iced it because there was some swelling and I was still in a lot of pain this morning, so I've been taking ibuprofen and Tylenol.
Okay, well, let's take a look.
Okay.
Okay, so I can see that there's definitely some swelling and bruising, and so I don't want to perform any ROM on you because I feel like you could have a break or a fracture. So can you just tell me, am I allowed to?
Yeah, totally.
Does this hurt at all?
Yes, along there,
What
right
about
there.
here?
No pain.
Does this hurt?
A bit, yeah.
Okay, so I'm going to send you in for x-rays to see what's going on in there.
Okay.
So your x-rays came back,
Okay.
and take a look. It shows that you have a fracture in your fifth metatarsal on your left foot, which is also known as the Jones fracture. So it's not bad enough to where it's going to require surgery,
Okay.
and this is a new injury, so this hasn't been something that's been occurring for a long time. This happened a couple days ago. So I have evaluated and taken an x-ray of your foot to determine the injury.
Okay.
And there was no medical professional on site when the injury occurred, correct?
Correct.
Okay. And then your injured body part is your foot, your metatarsal, and it is definitely a fracture, but not something that healing process won't fix. And you should be returned to activity in 22 days or more.
Okay.
So just like a lot of rest, and yeah.
Sounds good.
Treatment of this injury begins with immobilization of the foot in order to promote healing. This will also help protect the metatarsal from further injury. Crutches are needed to keep pressure off the foot in order to prevent further injury. Icing is used to reduce joint swelling. Is important because it will assist in inflammation going down. Ice baths help combat the small tears in the muscle fibers and relieve soreness. Once swelling and the likelihood of further injuring the metatarsal has been reduced, the patient can begin exercises to help strengthen their foot in order to get back to their activities as soon as possible. Because of the likelihood of re-injuring your metatarsal, it is important that therapists design progression of exercises that will safely mature the connective tissue and prevent further injury. It is important to keep in mind that stretching should be specific to the tissues injured. Emphasis needs to be placed on controlled progressive exercises that become more intense as healing progresses.